already this morning are into the negative teens. And if you can, limit how long you're outside if you'll be one of the millions of Americans in the midst of this bitter blast. At this point, 60 million people under some type of winter weather alert this morning. Frostbite, hypothermia can settle in quickly, so it's important to know the early signs.
Dr. Jen Caudle is a family physician and associate professor at Rowan University. She joins us now on Fox Weather. Dr. Jen, so good to see you. Thank you for joining us this morning here on Fox Weather.
Thanks for having me this morning.
Now, of course, every winter we have cold weather, right? But I think a lot of us ignore the signs that we're not just cold, we have a health issue at play. So what are those typical signs that we should be looking for?
Well, so first of all, let's talk about some of the risk factors for hypothermia. You know, we are seeing some weather happening right now, and I want people to know if they're at high risk for, basically feeling the effects maybe more than others of this cold weather. So people who have chronic medical conditions, people who are older, young babies, people maybe who are not able to communicate very well, right? People who are socially isolated, those who are housing insecure. And then we also have to remember that alcohol also impairs our senses. And it's tough to sometimes be able to tell if we're cold, how cold we are, if there's alcohol or substances involved. So I think it's first important to understand what the risk factors are, but certainly anyone is potentially can get hypothermia or too low of a body temperature, which can be dangerous, if not deadly.
I have to say, I was out in Nebraska a couple years back, and it was minus 40 with the wind chill. And the fingertips, I could not get my fingertips warm, and it burned. What are some of the feelings that you may have when you're experiencing like the early onset signs of some hypothermia, and how can you then counteract these effects to warm up your body?
Yeah, so there's a couple of things at play here, I think, that what you're describing. So hypothermia is when our body temperature gets to be too low. Frostbite is when our tissues actually begin to freeze. Both of those are separate conditions, but they're both equally as sort of dangerous, potentially problematic. So there's a few things to keep in mind. When it comes to hypothermia, and we'll start with that one. Again, that's when your body temperature goes too low. It can literally change the way you think. It can affect your brain tissue. So sometimes people get confused. They start to they're not themselves. They might seem delayed or slowed, confusion, dizziness, things like that. With frostbite, again, tissues actually freeze, but there's different phases. So if your fingers are changing colors, if you just can't get warm, if there are danger signs, your fingers feel like they're burning, etc., you do want to seek medical care. That is important.
Now, doctor, I think you brought up a really important point that some of our family members, they can't tell us that they are too cold. I have an autistic child. For those that are watching that might have a parent that has dementia, what are some of the nonverbal cues that we can look for that we as caretakers can say, okay, this person needs to get inside and get warm?
So that's an excellent question, and that's going to be, the answer is actually very individual, right? So for every person, whether it's autism or whether it's dementia, et cetera, each person is going to have their own potential way of communicating that hopefully the family knows best. What I will also say, though, is that honestly, there may not be sort of classic signs at all. This is why it's really important that we're checking up on loved ones, that we're paying close attention to the environments that they're in. It's one of the reasons why actually social isolation is a risk factor for hypothermia, because when people are isolated, they're off by themselves, we're not monitoring them, we may actually have to decide for our loved one that we think there may be a problem. So you bring up a really excellent point. Sometimes this is where we have to sort of jump in and say, wait, is there something going on that my loved one is not able to communicate with me about?
All really good information to learn, especially dealing with the very cold air we've gotten. Cold weather advisories for northern Montana, temperatures minus 20 at some instances, especially with a lot of folks wanting to get outside this time of year. It's always important to know the risks. Associate Professor of Family Physician at Rowan University, Dr. Jen Caudle, thanks so much for sharing your expertise.
Thank you.